Okay, welcome to House Human Services, another version of what did we do this week? Um, Sorry, I know. Okay, so we have a bit of time this afternoon before we start going into the governor's proposed budget and the slate of witnesses that will be joining us over the next this afternoon and tomorrow, most of the day tomorrow. So I would like to point members to the website. Lori has been busy posting documents that we have received, some over the weekend, from various entities, including the secretary's office. And so you will see those on our committee's webpage. Those under today's, I'm just looking, there's a bunch under today, but these are not everything, but I've tried my best to make sure that everybody receives. If it didn't go to the whole committee, I've forwarded it to people, but Lori has also been doing a good job of seeing them. And so then you will see them posted on today's, but are there some posted like last week too, Lori? I
Yeah,
think,
and if-
yeah.
People are looking for specific ones, just let me know and I can easily.
Okay. So I'm going to suggest to folks that they may want to, I know I don't normally say this, but may want to print them all out, because much as we did with last year's version of a bill, we went through each piece of feedback to say, what are the things that we think that we can build upon? What are the things that we agree with, don't agree with, need more information about? I do want to let folks know that on what day, Lori, are we having Chad and the crew come in?
Wednesday.
Afternoon, tomorrow afternoon. So I felt like we needed, so we've been operating under a sort of this notion of that we would utilize as many of our existing systems as possible and build upon those. One of those being coordinated entry and the assessment process in coordinated entry. And one of the thoughts that we had about that is that that process results, after completing the assessment, results in a prioritization, if you will, of individuals and a needs assessment that identifies, what are the next steps for this person, essentially this household. I felt like before we kind of like 100% landed in that direction, that we needed to have more information about that process and what that actually looks like. What, we've been told that it results in this score at the end, if you will. But honestly, I haven't ever seen that. And so I thought it would be helpful for committee members to hear more about that process, and especially if we're going to rely on that for prioritization of needs. And so on Wednesday, we have the Chittenden County group, and we have the Balance of State group, the two COCs coming in to give us a presentation and kind of walk us through that. So they'll be here tomorrow afternoon. That will, I think, help solidify for us, is this going to be a viable tool for us to use? What are the things that we can build off from with this tool? And do we need to have something in the interim between when we have expectations that there'll be a wider variety of community partners and the state who utilize the tool? Do we need to have some process in the interim or not? I think that's an open question. So I wanted to let folks know that we are going to be doing that tomorrow. I also want to call people's attention to the fact that we received a copy of the written comments, as I mentioned, from the Agency of Human Services. We have some from community providers. We've heard from COTS. We heard from HHAV. HHAV has additional materials that will be coming. And I do want to let people know that I had a long conversation with Brendan Atwood over the weekend. You know, we talked about a path forward. It didn't seem from the testimony that there was a belief that there was a path forward, and I think that we are trying to maintain the hope that there can still be a path forward somehow. And so for people sitting around the outside and for committee members, just so you know, we will not be voting on this bill this week. We're going to have continued work on it. And we'll see where we land. We will get, if we do get to something, we will have a vote next week, primarily because we want to make sure that we do this while we have Katie here. And so I just wanted to give people an update about sort of things that have been transpiring over the last few days. Any questions about that? So I think it would be helpful for us to take a look at the Agency of Human Services feedback. It's on the webpage under Jenny Samuelson, under her name.
Looks like it's what the testimony was.
It's what the testimony
Yeah,
was. Yeah, it's not anything different.
Yeah.
I think that I'm just gonna, kind of come to all right, in the end. I think that some of the things that they talked about was time frame, appropriations, and of course, we hadn't gotten to the appropriations section yet, so no, they didn't see it in the bill yet, other than a placeholder. And I will have to say that sometimes when you're at the point where it seems like, you have one party saying you're opening this wide up broadly to anybody, and then you have another party sending you feedback saying this is far too narrow, you're limiting access. It leaves me confused. They're both looking at the same document and coming up with different conclusions. And so sometimes, I don't think this is one of those cases, but yeah, sometimes when you have differing parties and everybody's unhappy, then you've struck the right balance. But that's not the case yet. I'm just saying that out loud.
We're working towards making everyone happy.
The one thing that will be clear when we are finished with this bill is that we will have made no one 100% happy, including ourselves. So I think that is something that we all have to get comfortable with. And it's a place of being uncomfortable. I'm looking at, we can go through each one of these pieces of feedback. We've got legal aid, we've got HHAV, we've got COTS, we've got End Homelessness Vermont, the department, the Agency of Human Services. It's not, other than saying we need more time, and saying that it needs continued refinement, that's essentially what they say. And that it needs to pair the system with the money, which we know already. I think that, why don't we take a look at a couple of these pieces of feedback today. And, um, let's start with Vermont Legal Aids. Just because that one's on the top of my printout list.
You know, where that,
Does anybody want a printed copy of that? Right.
yes, please.
I love hard
Because you
copies.
Yeah.
Okay,
It was on my morning agenda to print out all the.
it was on mine too, instead
But
of
I
said,
didn't do
Lori,
it.
will you do that? I was like, I asked Lori really nicely and she
I didn't. Remember.
was very good. Okay,
Here we go.
all right, I'll wait till people get.
I found it. Raise my hand.
Go ahead, son.
I just would like to say that I really appreciate that we're able to, just that you're talking and we're getting this, a lot of these comments and things out on the table. I have like 6 kajillion questions, to even kind of get my bearings in a sort of way. So I'm hoping
I
that,
think that's great.
I think that these questions will, I hope that as we go through this, we can keep, my dream would be that we can keep our concerns at a rather high level and not get down into rabbit holes and details, because I think the question, it seems to me, is the big question is this moving forward? And if it is, how is it going to move forward? And I don't expect an answer to be just like that, but I think we'll discover in all of this. It strikes me that staying at the highest level possible will get us more toward that question. Just to say that.
Thank you. And I, just as I know that last week we allowed, comments and questions from the side, not doing that this week. So comments and questions, will only be from committee members or alleged counsel. We're also, I think, I'm going to start with sort of the broadest concept, which is creating a continuum of services. So that's kind of like the I guess biggest notion of change here is that, do people on this side need a written copy?
Katie, did you get one? Hey, Tommy,
They're coming along. Okay.
if people are thinking for deadlines, Thursday the 12th. Yeah.
Yeah. Thank you. All right.
So let's do that. I mean, because I think that it's important to have some discussion among committee members. And like, is the concept of really a system redesign. We've started with the hypothesis that what we currently are doing needs to be changed. Can I ask, are people in agreement with that hypothesis that what we are doing currently needs to be changed? Because if we're not in agreement with that, then we don't really need to go any further. Yeah, this is just discussion. So anybody, as long as 5 people aren't talking over one another. So,
Oh, I agree.
yeah.
Yes.
Oh,
It's not working.
yeah.
It's not, current system is not working. I'm in agreement. We need, it needs to change.
Is that consensus around the room?
Actually, I think we're fine.
You think we're fine? Okay. Anybody else have any thoughts about that? Yeah,
I think my only thought is that it's nice that this is really, it seems to be an agreement point between us and the agency right now. You know, in their first paragraph and in their last paragraph, you know, they talk redesign is the exact word that they use. And I think our visioning of how that looks is maybe different, but especially on like the case management piece and coordinated systems piece, but yeah, that's a good point of consensus. It appears.
I agree.
Yeah,
Yeah, I just think every month when we look at the report and we see older Vermonters, that number, we can do better on that portion of it. I always think we can do better. The fact that there's all the people are there, but specifically that cohort, I look at and say, should be able to do a little better there.
I'm gonna allow for some pregnant pauses here, people.
Well, I mean, it's worded variously, but it, in terms of change, I think, most of the perspectives have shared that the hotel motel system is not a system and is not the ideal way to move forward. So how that transition occurs may have a widespread of opinion, but that seems to be pretty broadly held as part of why what we're doing now doesn't work. One of those components is that relying on putting people in motels and hotels is not the right path.
I would add that while it appears differently as far as how the administration is suggesting we advance and some of our discussions, I think overall the tenor is that there are more people-to-people supports for Vermonters who are experiencing homelessness, whether that's in the cornerstone aspect, I think, of what the administration is looking to do, which is specialized to a larger degree, specialized shelters, or what I'm taking as a significant part of our conversations is the coordination of services or case management. Both of those approaches focus on giving more direct supports, I think, to Vermonters, finding them where they are and moving people forward. So again, I think that's a common ground that can be focused on as part of our work this week.
I would agree with that. I think that it's that right behind what Rep. Cole said is the notion of where we agree that what Rep. Bishop has suggested is that with this, the next thing that we're looking at a project or a program that can turn to face every Vermonter in this situation, finding a way to address them, whether or not we'll be able to do that or not. But that's the mindset. It seemed to me that I also very much appreciate that in this last conversation, that there are so many players, so many thoughts, so many ideas, so many people engaged in this, in the thinking of this. Again, we're not at a solution quite yet, but that there are many, many good ideas playing here. And so hopefully we can weigh all of those and all these good voices can continue to come forward and we'll be able to get to a place that's workable.
I thought H594 was actually moving us in a good direction, and I was shocked when it was taken off. I was really disappointed because I had talked to some people in somewhere, and they were even happy, and they were the ones that we really need to make happy to make things happen. But I just didn't like the return to home because Brenda said sometimes people don't have a home to go to. I know my brother told a nursing home, I'm going home to my sisters. They called me and said, I guess, is your brother moving in with you? No. So it does happen because I've had it happen. It was hard to say no, but so that was the only piece. I think H594 was really gonna move us somewhere, but
we still have components of 594 in here.
I think that's I'd have to go back and look at it to remember.
Yeah.
Yeah,
How did that one differ? Where did we make changes?
go ahead.
I think another place where I think there's alignment with the administration, which I don't know if it's been explicitly said, or at least in my opinion, there's alignment, is that, I think the administration is really thinking about reducing the number of hotels and motels that are being used. That's our goal as well. But I also, in my mind, when I think about an integrated system that we're proposing, I do think that it will mean that we won't be able to provide those services to everyone, right, that needs it, because we have limited resources. And as much as I don't want that to be the case, I have to be practical that that is going to be the case. So I think, I think the testimony from the department kind of made it seem like we just want to house everyone that would need housing, which ideally that is the case. But if we want a system that will help people through the process and get them to transition to permanent supportive housing, that will mean that we are not going to have resources to house and provide those services to everyone because we have limited resources. I think that's a place where we align, but I have not heard that explicitly said in the committee.
Right, and I think the problem, I mean, when I first read the definition of eligible population, family, whatever, my reaction, if you took that in isolation, you'd like, well, if everybody's eligible, I mean, we might as well quadruple the budget. We can't do that. And if you read, that's clearly not the intent. And when we talked about the prioritization of need that we'll find out what happens with the coordinated entry. If you're talking about prioritization, there's no need to do that if it's not a recognition that there isn't enough and that only the higher level is going to get what we'd like to do more of. But I think, that's part of the tie to the budget and the part that we haven't gone through yet. I think, I brought it up once last week in terms of, well, we don't have a process in here yet for how people appeal. And of course, if everyone got everything they wanted because everybody was eligible, you wouldn't need an appeal system. And I think that's part of maybe how some people got a misimpression that that it meant that using that just definition for eligible population and not being explicit about the connection with the budget because we hadn't gotten there yet creates an impression of a system that isn't sustainable, no matter how much it might be the ideal. Whereas I think our intentions are more aligned with what, and I confess would have to go back and read the original bill to remember how that one was structured because my mind went to what we were doing in front of us. But in terms of the intent and the direction that we want to go, I don't think it was that different in intent. I think it was, I think we were trying to come up with a clearer structure and a clearer, the idea that being a clear continuum of what was available at what point just makes a lot of sense and made, the more we discussed, I think the clearer it became that was foundational.
I think one of the things, I know I've said it half a dozen times at least, that I didn't have any intent of going beyond the governor's budget.
Right.
I've said that repeatedly, that this would be within the budget that the governor has presented. So I think that's, I guess I would hope that would be a level of agreement between us and the administration. I'm not sure that we will 100% agree on sort of like all the different buckets. But I think that there'll be some substantial agreement about those buckets. But, I feel like I need to say it again, because if you might not have, if you don't feel like it was clear, then other people might not have felt that was clear. We have a lot of good feedback from people saying we need to do more for more people. And I just have to be clear that we're not going to be serving everybody. And I know that that's a hard thing to hear. It's hard to say when we know that there are people in need, our fellow Vermonters. But we do have resource limitations. It's not an unlimited world. And it's how do we invest those resources that's going to get us to outcomes that include more stability for people who have been unhoused, for people who have maybe been unhoused for long periods of time, for people with health issues, for people with other disabilities. You know, I keep thinking about, we heard about in our Democratic caucus this morning, we heard about government accountability, and a bill that's coming out of GovOps. And I'm thinking about, okay, how will we measure the investments that we are making? And how will we know whether or not Vermonters are any better off as a result of this, whatever system that we end up agreeing with? How will we know if they're any better off?
And ideally, I think when I think about the accountability piece and kind of a look back and outcomes, is each bucket should have its own kind of measures and what we're looking at, not, obviously the whole system does as well. But, I think to our committee's point and to your point, like up to now, we haven't had an integrated system that is easy to measure, right? We've had a kind of piecemeal effort. We've had a lot of community providers that are getting grant funding to do the work, but it's not a coordinated, integrated system.
Nobody is measuring outcomes.
Nobody's measuring outcomes. So
Yeah.
not only is it hard to do, nobody's been assigned to do it. But if we have these buckets of
Can somebody turn
funding,
their cell phone off, please? Thank you.
if we have these buckets of funding and then we tie actual outcome measures to each one and have like a frequency of like look back, is it annual, is it every, 3 years, to kind of see, okay, we said theoretically by offering more supportive housing and supportive services, the reliance on hotels and motels should decrease because we're building more shelters, we're building more housing, right? Like, how is that continuum working? And are we seeing that correlate, what we envision actually happen?
And I was going to say, likewise, the investment in case management that we
Right.
are envisioning. I think one of the tangible things that we can measure that's been a stickler for me is the number of individuals who return to homelessness after having been placed. And so having follow along services for that group of individuals, if we can see a reduction in the number of people who return to homelessness, we automatically reduce the number of people who were
That's homeless.
homeless, right?
Those are positive outcomes.
Yeah.
Do they ever keep data on the drug bust, the people that are getting the free hotel and then they have a drug bust and they end up getting arrested, and the rape and the assaults? Do they keep data on all that?
They being who, DCF?
Yeah.
I
I
don't.
know when I worked there, we had to put it in the system, but nobody ever did anything with it.
Yeah, I don't know what data they keep on that.
Yeah, I'd like to see that data.
Yeah.
How many people are receiving it that have abused it? And then, because that's not fair to the people that won't abuse it.
Doug and then Dan.
So a piece that I'm struggling with, and going back some history before my time here, but the legislature and the governor reached, I'll just refer to sort of a grand bargain in reducing the number of motel rooms that would be utilized, right? And that was a difficult choice. The governor was trying to spend less on behalf of Vermonters towards this program. We were trying to support as many people as we could, et cetera. I'm not quite sure where the grand bargain is here with respect to the numbers because they're so far apart. If we look at the number of adults and children that are currently in the motels, that's 1,676 and 481, and we have 680 beds in shelters, so that's 2,837. The one concrete number we have as far as rooms or people served is the governor would like to get the motels down to 325 rooms. Not sure how many individuals that translates to. And there's obviously a big gap. And I'm not saying that the governor wants to reduce to the fact that we're going to help 325 people. The difficulty for me is there's lots of different specific shelters and dollar amounts that have been provided, I'm not sure how many people those are intended to serve. So between 2,837 people and 325 rooms, where are we getting to with the governor's proposal with these dollars spent on how many people we're going to be supporting? And
They actually highlighted that in one of their graphs. When they did their proposal, they showed current and they showed, future. I'll pull it up. Keep going.
no, well, that will be helpful for me because I think in part, how we support the individuals who are going to receive supports through whatever program we create is part of the equation, but I think it's hard to overlook the fact that the number of people served will be an important part of this discussion. And I apologize that I was not recollecting that, or it didn't sink in when we saw that number, but
It's okay.
we haven't had a lot of discussion, I guess, on that part of it. And so I'd like to ensure that we do that. Because I think another grand bargain needs to be
Sorry.
struck.
Yeah. Dan then's on and then,
I just want to go back to the accountability that Ray was just talking about and you were talking about in the buckets and how do we,
hold on just a second. Lori, will you see if you can find that presentation for me? It was their housing. No, they said that when they provided additional detail, I think, DCF to us. I think it was week before Ness. Go ahead.
thanks. So just back to the buckets of accountability and what those buckets are and what the accountability is around each of those, whether it's the state, the providers, the individual, but there's other things, the hotels, right? There's also some accountability to the hotel about, is it livable, right? What does it look like? And I think about like, how do we figure out what all those buckets of accountability are? And then do we basically, in our legislation, are we thinking about assigning what the accountability is? Or do we say, look, this is the state. Here's the accountability we want from the state. And then the accountability to the providers, the hotels, the individuals, like that comes in outside of the legislation working. I don't know. I'm just, do we say, all right, come up with the accountability standards for people to, whether it's individuals to participate in the program or the state to get the money out on time and, make sure that people are paid and that the providers are making sure that the individuals receiving the case management. So just.
Yeah.
What does, it's kind of a bigger picture than just a few buckets. Seems like there's lots of different pieces that could be measured for accountability to make everything kind of work.
Well, and, part of what we did in the childcare bills, we charged an independent organization to evaluate whether or not we were making progress.
Which I would vote in favor of doing that here too. I
Yeah.
know that costs money, but I think it's a great investment because it is a third party and oftentimes the people in it don't have the capacity to do it or the expertise to do it well. And this is this on the administration, but to charge an external expert to actually look to see, we heard testimony of recommendations for a study to figure out actually what will it take to address. But I think this is a step towards that is, okay, you implemented this bill. We need someone who is not implementing it to actually tell you how it's doing rather than, because it's a big investment. It's a lot of money.
Yeah.
And you've heard all different things in our testimony. So back to Ray's point there, that someone who can look at it from the outside, who can actually ground truth everything, could be helpful.
I would add on to what Dan has said that I'm getting spoken to about, and we've talked about this a little bit, but communities are having to bear huge amounts of alternate responsibilities related to this issue. And there's no accommodation for those necessarily, or that they'll tell you stories in which there aren't. And while I don't think it's probably the scope of a bill like this to deal with all that, but that is part of what it means for Vermont to be accountable for this entire situation. It needs to be looked at as well, I think. So we have data, it's data really that we need to collect. So I support the notion of a consultant.
I did try to read through some of the newer sets of comments that had come in, and one of the things that came in from several different ones is the issue of transition or
Yes, that's-
implementation. And I know that that's something we've, you know, kind of had in the parking lot. We know we have to, but in some ways, not getting into any discussion is part of the problem, because I think we have a sense, you know, you can't be shutting down hotel rooms if you don't have shelter rooms yet. That's
Mhm.
kind of that discussion of one for one versus, but if you only have so much money, how do you do both? That's really all about transition and how it happens within the budget. And how long do we anticipate that is going to have to take? Because I think we're working on creating a system that's where we think the system ought to be, at least, you know, then it gets revised as things work or don't. But we know that July 1, that's not the
Mhm.
system we're going to have. And
Right.
we don't really have a time frame or how that phasing happens and how the pieces start working together. What happens immediately and what doesn't really crosses over and impacts some of the questions that are being raised about how far afield is it from the original thinking or what the administration worked on jointly and so forth. Because I think we've been talking a lot about the ultimate plan, but not talking about the transition, which is in some ways the very toughest part.
Yeah,
Absolutely.
it gets to this gap that Doug was talking about.
Right, that's right.
Okay. Sorry, I'm trying to. On February 5th, I think that's, I think that is.
That just housing initiative.
And then also the DCF budget presentation is in sometimes.
Yeah, it's the Thursday, February 5th. I found the document. AHS, Addressing Homelessness in Vermont, AHS Housing Initiative, DCF budget.
What I'm remembering as a graph in that presentation. Oh, no, it's not that one.
But I would look at the,
There's another one where she said we have additional details. They came and they gave additional details.
After that, that's right.
Yes.
I remember them saying they were gonna, right, do remember that.
That was February 5th. Yeah.
So it's after February 5th.
Right, and that's,
That much.
well. Is anybody else besides me remembering that?
Remember the part about additional details.
It rings, yeah, but I remember us
I don't
having a
see
presentation
it.
on that and
We did.
it rings a bell that it had that more detail that you're talking about, although I can't.
I think they were here before February 1st, perhaps, and so the details might have come even before that.
We had
Okay.
somebody on the side who might remember.
I see what Chad sent, January 28th. Okay, so if you go to January 28th, isn't it funny? I thought it was after that, but I'm not sure. This is the exact one that I was thinking of, but it does have the high level overview on the second that shows the breakout between the shelter beds and different kinds of units, shelter-like options, traditional GA, emergency cold weather,
What's
adverse
that
weather
title
conditions.
under?
Kristen's.
Um,
Yeah, it's Krista McClure's, 594 testimony.
Okay, so that's it. They were broken up by
Page 2, yeah.
departments, so that the one you're talking about is in the AHS and DCF.
Here we go.
Okay.
Yes,
People find that?
I see this. high level
I remember
overview.
that, yep. Phased approach over a few years. Well, that's what, part of the phasing question.
I feel like there was even an additional one that, but this has got the graph that I was thinking of, the one that says high level overview, and it
Yep,
shows them side by side. That's what I was thinking of, Doug, when you asked your question about.
Right, and there was additional information, one of the budget documents, and I apologize, I didn't remember, that does, medically vulnerable, approximately 60 people,
Yes,
family shelter,
Yeah.
approxichtly 240 rooms.
well, it does have suggested phases, but it doesn't say, well, and then.
so,
The timing, I guess, to a point I think
Yeah.
Donahue is making sort of, and we all are concerned about, is the sort of the ratcheting up, ratcheting down, one for one concept.
well, and I think that the reference that you made, Doug, to the 300 and something, that was, I guess what they were referring to as traditional GA. So, and then, we do have a combination of what they calling shelter-like options. That's the use of hotels as well. And then, cold weather is the use of hotels as well. So, it's just, looking at those different shades in blue is, they're labeled differently, but there's a lot of continued hotel usage in the
They're just not called.
AHS
Hotel.
proposal.
Yeah.
Yeah.
Right.
Yeah.
Maybe to just continue on that point, I mean, if we're looking at, those
Yeah.
shading, like that large, really dark blue chunk, those people can be housed for more extended periods of time, whereas the adverse weather conditions, emergency cold weather, those are gonna be like a day, 1 day, 2 day, so we can expect for most of the time, until somebody can acquire really affordable housing, which is gonna take a long time to include, I hope I'm not being out of line here and saying it's approximately like, just about another 1,000 folks who are gonna be not having long-term shelter because they are not included in this bottom chunk, which is shelter, which implies like longer term housing, like this adverse weather, emergency cold weather, that's like a night period. So it's like, that's huge. Like, and if they're not in shelter, and they're not in affordable housing, they're on the streets. So I think we can assume that chunk is long-term going to be increasing or, getting up to like 4,000, 5,000, 6,000 people on the streets instead of, I don't know. Maybe that's a
I think that's a stretch.
Okay. I'm sorry, maybe in that last statement there, but hopefully my point coming across is clear, like the shelter piece, which is staying just slightly larger than on the left side graph, like that huge chunk is for 1 night, 2 night, like I don't know where those folks are gonna be otherwise, whereas they were included in the F26 piece for more extended periods of time.
I don't think it's well labeled enough.
That too.
I understand that. That's
Not
the
apples to
problem.
apples,
And
right,
and
yeah.
it doesn't really, doesn't,
But if the colors were to be, like if that is what they meant by the colors being side by side, then that would be my interpretation of it, but it isn't clear with the labeling.
I think it's a little, when you look at the phases
Absolutely.
and what the transition discussion, which is really about how many options are you closing down before new ones open up, right? That's really, and it's where in part it's saying, at least for whatever targeted populations mean, which in some ways are maybe the old prioritized ones. And we're saying different in a way is use a different priority system that's more individualized through the coordinated entry, but saying utilize hotels, motels to function like shelters. In other words, still using those spaces, but using them differently.
Well, I guess one of the things that it's kind of making some presumptions and that we don't really know yet about the willingness of
Yes.
community partners
Okay.
to step into those spaces.
Right.
So I think, from a transition process perspective, utilizing shelters plus services is a decent way to transition from one space to a more preferred space. But I don't know that there are people out there who are, whether the department has engaged with, whether it's community action, whether it's existing shelter providers, whether it's other, the members of our local housing coalitions, what's been the engagement? I know that they have had, they had kind of a working group going at one point in time this fall, around, sort of, I guess, future planning a little bit. So, we can set up a system that utilizes that, but if we don't have somebody who is willing to step in and provide that, I think that's I guess that's an outcome to be measured. That wasn't successful,
Yeah,
but I guess that's important to know.
absolutely. Keep moving forward.
Because, I want to make sure that we've kind of delved into specifics now. We've moved up from the sort of high level general discussion that we were having before. But so I made some notes on things that we seem to all be at least have consensus around, that there needs to be a system, the system needs to change, that we need to reduce reliance on how motels and hotels are utilized as they are being utilized right now. That we need a program that is facing every Vermonter where they are, and that we're living within the governor's budget as recommended. Those are all sort of key elements of things where there's consensus, if not 100% agreement, but at least consensus on. So we've talked about utilizing a continuum of supports and services. So everything from prevention and diversion through to services that more supportive housing types of services. And supportive housing services doesn't just mean sort of what is known in the DCF world or in the shelter world, but also in the Dale world, in the mental health world, in the DSU, VDH world, so we're looking at broader when we say supportive housing. And we've thought about how you transition in phase. We've thought about having to have more case management in the community so that essentially everybody has a lead case manager. And we've talked about everybody needing to participate in coordinated entry and having essentially a needs assessment done so that we know how best to match them with whatever supports and services that might be necessary for them.
And make it required.
Yes.
Okay, that's where the breakdown is. You can say you have to do it, but you have to require it or you lose your housing. Otherwise, it's never gonna happen. Some of my nephew owns one of the hotels and they sleep all day. It would actually be good for them. Give them a purpose, give them somewhere to get out, somewhere to go.
Mhm.
Yeah. And his hotel's on the bus route.
That
So-
is the requirement in there now, that.
But it's not enforced.
Well, I mean, I think that be one of those outcomes that is measured.
Yeah.
How many people are participating in the coordinate, how many out of the total number, how many coordinated assessments were done, how many people been engaging in
And how
case
many lost
management.
their housing because they didn't do it. It's gotta be followed through.
So that's this notion of this continuum of services and supports that has elements that we've talked about. That's sort of the concept of a redesign that we've talked about. Which is, I think, saying in a different way, but saying similarly things as what 594 did with the use of the tier,
Just reading it right now.
right? The tiers, it's just calling them something different. That's the way I look at it, but other people might have different ideas. So what are people's thoughts? I mean, again, I'm coming back to basics. What are people's thoughts about establishing a continuum of services and supports?
So I have thoughts in the sense that everything that you've just summarized sounds like, to me, a reasonable way to frame all of this and a way to go. The question that comes to my mind is, as it is right now, if we were to stop at the continuum of care notion, but just talk about all the things that you listed prior to that, that it seems like there's agreement both among numbers of parties. How many Vermonters could be addressed? How many people would be left out? I guess would be the question. If we were to just make that transition, would we still be leaving people out?
We're
so-
always going to be leaving people out.
So the question for me starts to be, because there will always be people left out until we are able to supply either more money or more services or more housing, yes, all of that. We're trying to transition toward systems that will move us in those directions. All three of those are in the future. So there will be people left out. That seems to me part of the transition that we're making. So what are the systems that we can put in place, or what do we need to think about? What are the challenges that are not, or the barriers that are not deal breakers? It seems to me like right now we're kind of stuck with the administration at some deal breakers. It appears, it feels like that. But maybe they're really not deal breakers. Maybe there are challenges that we can look at that we can solve together to get toward better numbers inside right now, a budget that won't allow us to take care of everyone, but we can nonetheless start thinking about a transition that if we were to make greater investments, we might be able to make some headway in this. Am I making any sense?
Yeah, I think so. I mean, I was
You
just,
lost me a little bit, I'll be honest.
Okay, I don't need to try again necessarily.
No, that's okay. I was trying to, I wasn't sure exactly what you were saying, that
So
there's a recognition that we're not going to serve everyone.
we know that.
We know that.
Okay, so
I was trying to figure out if you were suggesting there needed to be some sort of prioritization. You didn't say that. That's what I was trying to figure out. if
I mean,
that's
I think
what
in
you
the transition, it strikes me that there's no way that we can do this without some sort of prioritization.
Right.
There just has to be, because we can't address everyone's needs. So either we say we're not addressing anyone's, or we're going to move forward. And what does that look like? And we move toward the notion that we're going to try to meet everyone's needs in the future. I don't see how else we can do it.
Well, we are talking about, people don't like to hear this word, but I'm going to say it out loud, rationing services.
Yes, I understand.
And rationing services to particular individuals or households with particular presenting needs.
So for me, that's where we are now. We're already rationing
Yes.
at this moment.
Yes.
We are rationing. So we're not changing, we're not going backward, as in my view, as the administration suggests, that we might be going backward. I don't think we're going backward. I think we're seeing the situation as it is and trying to figure out how can we go forward toward a different future. That's what interests me. And so what are the mechanisms that we can put in place to move toward a place where we're rationing less and less as we go forward?
Or more effectively.
Or more
We're not doing
effectively,
it
yeah.
effectively, where someone
Yeah.
is going into
Yeah,
admin and that is
yes,
not
exactly.
actually serving.
Efficiently, all that, effectively, yeah.
One, I think of the bigger issues I have with the administration's plan is it does focus most, if not all, the resources, except for those kind of emergency ones, the ones who, they view as the in most need. And one thing I really like about kind of the HUD continuum of care and the programs and funding opportunities available is that there are different options for people with different needs, some with very high level needs and some with lower level needs. And yes, I think obviously those with higher needs, those cost more money, and that will be where the bulk of the funding is. But if we are ever going to make any kind of progress on actually addressing homelessness in Vermont, we do need to actively be addressing the needs at all levels. So we're not going to meet kind of each of those categories needs in full, but if we're not doing prevention, we're just going to continue to have more and more people entering homelessness and becoming unhoused and then eventually getting to that chronically homeless status. So I think that's why I prefer where this committee bill is going, is because it does bulk up all of those different kind of levels in the system. Whereas where the administration, and I think 594 was going, is really putting those highest needs first. And I think that's something this conundrum we come up in a lot in our systems of care and serving older Vermonters as it becomes this crisis. And so we feel like we can't do anything but focus on those highest level of needs, which are the most expensive. But in doing that, we're never truly solving the problem.
It's, to use the older Vermonter analogy, it'd be like if we were taking all of Choices for Care and only funding nursing homes, the most expensive part of the continuum. Now, they take up the bulk of the funding, I will say right now, but there's tens of millions of dollars going to community-based services. And that was actually a major shift that happened 30 something years ago, because we really only were funding nursing homes. And so I think that it helps me to think about that analogy when I think about the system. And I think we're very short-sighted if we're not funding on the prevention and diversion end, because that just makes us more customers on the other side, and that's not what we want.
So we can say that about almost
Anything.
all of our
Yeah.
systems. What we're looking at this year's budget for DCF, we're putting millions and millions more on, 6 or 7 kids in the highest level, and we're cutting prevention and not the DA system, mental health, all of those different things. It works the same way. It was helpful for me just in terms of some of it, maybe even from what you're just saying, the labels, how one deems who's the greatest need, because our discussions also focus on a way within budgetary constraints on who's the greatest need through the coordinated entry. It's more individualized rather than categorical, but it's still focused on who's the greatest need. And, when you look at the budget components in the administration's plan and the investments, I think there's a lot that's really similar. There may be some shifts in how much goes where, but there's a lot of similarities. They're not the same titles, if you will. But, it's like goes up from 71 to 74 million between the emergency hotels, the HOP shelter funding, and other shelter-like options, which is the hotels and motels, but with, run as services. And so it's shifting that money, but, in the bottom line, it's $8 million more than it was last year in the total expenditures. So, we may see a priority in terms of case management, but it was 0 before, and it's, almost 1.3 million in this, and rental assistance from 752,000 to 2.1 million. So some of those things that we've been talking about are actually there. The concepts, I think, are defined differently and I think we have them more as a flow, as a coordinated flow of where you move rather than more isolated. But I think there's a lot in the definitional and wording concepts rather than fundamental, except for that conundrum of, you can't both, fully fund the community-based system and the hospital beds, so what do? You say, well, these are the most critical, so we got to fund the lockup DCF facility, we've got to fund the hospitals, and the community systems and prevention falls apart, and then we go in a downward spiral. But the very first year I was here, we were talking about alcohol specifically, and should there be a separate department for alcohol addictions and so forth. And it was, like we know, $1 worth of prevention saves $10 worth of care. The problem is right now we're spending the $10 on care, and we don't have the extra dollar. And the only place to do would be to take it from the care that we can't do because then people don't have any care. And I don't know how you get around it. I'm recognizing that this is the pattern that we have to try to break here. And as folks already know, my perspective is when we acknowledge we can't serve everybody, I still fall back to, but we've got to serve everybody at a certain level of not being out in the weather, even if it's only offering the opportunity at having a congregate shelter with cots, like in a Red Cross flood, because we can't do everything that we want to do to help people move. We can't do all of the higher end supports that people need. I still think we have a baseline that has to be available to everyone.
I don't disagree, but I think to an extent, we're struggling in opening the extreme cold weather shelter, creating that capacity that we have this year.
Right.
And I think a system we're moving towards is going to have more people who will be in need of that basic gymnasium and a cot. And I don't know where that growth is for that. I don't know where the community capacity is for creating the basic, to your point, at least having a gymnasium and a cot. I don't know where that capacity.
No, either. I don't think the communities can do that on their own. I don't think that,
Well, but even if given resources, it's hard to see where, Burlington opened a shelter with a capacity of 70 plus people. The other locations around the state that have agreed to be part of this program are much smaller numbers.
yes, I'm talking concept and direction rather than transition, like next year we have to do that first.
Oh, I get that. I guess I'm just struggling to see. I'm trying to now put the number of people to the numbers in this presentation about household. Some of them reference households, some of them reference people. And there's a fairly significant gap between the number of people we're serving today with the number envisioned here. And that's not surprising if we're upping the level of support services with the same number of dollars, we're going to support fewer people. So I was just making the point that if we want to then ensure that those who are going to be left behind to a degree from the number of people served now, I don't know how we would provide that basic roof over your head sheltering capacity where we struggle today.
No, that's where we struggle in terms of priorities.
Yeah.
Where we would make the priorities, which are never going to be identical. Any individual one, how you.
And Rep. Dahlia, I wanted to respond to the piece about prevention and Jubilee too, so prevention of course exists on sort of a spectrum, so prevention could happen from birth, to how you raise a child to, way down the line. And I think in this time of crisis, the kind of prevention that especially is within our committee's jurisdiction is, I think, shelter and case management, prevention from hospital rooms. I think that is when we hear testimony from the nurses, at this point, of course, we want to invest in, like, prevention is really, housing, affordable housing, and that we can work on and the Committee on Housing can work on and everyone can work on. But I think to prevent this at this, like, with the tools that we have right now in this committee, like that case management and just access to a roof over your head, those two pieces, I really, I think is not for nothing in terms of prevention. I think it actually will save a little bit for those who really shouldn't be having to navigate what they're navigating or taking on right now, municipalities, emergency rooms, et cetera. I think that is one of the most lingering questions that I have with the difference between the bill that we have now, or the draft we have now, and the administration's proposal, which is this case management piece, which is in the beginning, in the header piece, they say, we know that case management is important. We know we are not meeting needs in terms of case management. And there's a bullet point, about how this will increase access to case management. But I really, in terms of implementation, I do not see, especially in terms, at the head of the table, we know there's a lack of trust there. And sometimes when they use, I'm just, language on the record, such as dorm parents, that like I can't see the promotion of engagement unless they are really bringing in all the, like, we don't even know with whom in terms of case worker, case providers, social services, who they were engaging with in the process. We engaged with housing services, but I think maybe it was one or two. It sounds like it may not have been, from the way that we are getting testimony here in this room, and we are privileged to have a space to be able to take that testimony here.
Yes.
So I really think the language that we have worked out with the combination of 594 and this draft that exists today, in how, not just talking the talk in terms of case management, and I don't mean that in, to brush off anything aside, but truly the implementation of case management in a way that maximizes the efficiency of our very, very limited resources that we're working with here. I think that language needs to be very specific, and that is why we're being so deliberate in who we're hearing from. And I just, that plus recognizing that the 1-for-1 consideration of shelter, the time it'll take for shelter beds to come on versus like who's. Yeah, I don't know. Those two pieces, I think I don't see how they will be followed through with in what we were presented with, but I feel more encouraged. And not to shut down any ideas that are coming forward, but I really I don't see the value.
I think I'm just reflecting on, we're going to take a brief break before we move into budget testimony, in case you were wondering. I think that one of the things that is going to be hard for us sitting around the table to grapple with is the fact that in order to make some of the shifts, in order to invest more in that case management that we know is necessary, it means we're going to have to spend less in some other area. And that less in some other area is likely to be the hotels. And so it's not going to be a 1-for-1.
And that's kind of to my point earlier.
I know.
Right at the beginning. Like
It's why you can't say that we're going to invest if
supportive
unless we
services
reduce
and
from
case
someplace else.
management. And we know that is costly because that takes human resources. You can't automate that. That takes very deliberate on the ground work, and
you can't do it with caseloads of 75 either.
Right. You need to have smaller caseloads,
Yeah.
you need to be intentional, you need to have trained professionals doing the work, and that is an investment. So if we're going to be doing that, we're gonna have to have less investment in hotels and motels. That's just a reality.
Yeah.
Which is not easy to
No.
grapple with.
No. But that is essential. I mean, it's why I was just trying to specifically call attention to it, because it's a hard reality to live with. But that is the reality, that if we think that what will make things better is really that one-on-one attention that people can get with caring individuals in the community who can help them, who can really take them by the hand and say, what what is it that you need to help you be more stable? We hear over and over again that it's relationships are what makes the difference. And we need to invest in those relationships in the community. I don't mean with, and I mean no disrespect out there to the department people who are listening. I don't mean with 21 staff people, in the department. I mean with focusing that on our community partners who are going to be the ones who are going to be there on the nights and weekends when people call. I needed to say that up front because it's a hard decision that we will have to make if we are going to make anything move forward. All right, on that note, let us take a 15-minute break until 2:30, and please be back here right at 2:30 because then we have